COPD refers to a group of diseases such as emphysema and chronic bronchitis that causes airflow blockage and breathing-related problems. More than 15 million Americans have COPD, according to Centers for Disease Control and Prevention. Overall, men have a higher rate of diagnosis and mortality, but with changes in smoking behavior and increasing urbanization, the prevalence of COPD in women is on the rise. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and today I'm going to talk about increased COPD risk for women due to smaller airways. Structural differences in lung airways between men and women may be the cause for differences in chronic obstructive pulmonary disease prevalence and outcomes between the sexes. For this study, researchers analyzed data from nearly 10,000 participants enrolled in Genetic Epidemiology of COPD or COPDGene, a prospective multicenter observational cohort study of current and former smokers as well as never smokers between the ages of 45 and 80 years at 21 clinical centers across the US. The researchers looked at data of never, current, and former smokers enrolled in COPDGene from January 2008 to June 2011 and followed up longitudinally until November 2020. Airway disease on CT was quantified using 7 metrics: airway wall thickness, wall area percent, pi 100 or square root of the wall thickness of a hypothetical airway with internal perimeter of 10 mm for airway wall, lumen, airway passage in which air flows through, diameter, airway volume, total airway count, and airway fractal dimension for airway lumen. Each airway metric was calculated and adjusted for age, height, race, body mass index, pack years of smoking, current smoking status, and total lung capacity. In 420 never smokers, CT scans revealed that men had thicker airway walls than women, whereas after accounting for height and total lung capacity, airway lumen dimensions were lower in women than in men. In 9,363 current and former smokers, men had greater wall thickness, whereas women had narrower segmental lumen diameter. A unit change in each of the airway metrics, that is higher wall or lumen lower measure, resulted in lower lung function, more dyspnea, shortness of breath, poorer respiratory quality of life, lower 6-minute walk distance, and worse survival in women compared to men. The researchers noted that the research implicates that sex differences should be factored into the development of new therapies for airway disease. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.